You used to bring the smell of rain into my bed and lie so close to me. You could be inside my head. Maybe it's a once in a lifetime kind of thing to feel the kind of magic that your love brings.
Attention please. Send your collie to the nurse's station. Send your collie to the nurse's station. Thank you.
Guys! Ah! Holy freaking crap, we survived the weekend! I hope you guys had a good one. I sure as hell didn't. I had to work. And let me tell you, it sucked. It sucked pretty bad. We were busy. We had some really sick people this weekend. But hey, it's over. We made it through. And now it's freaking Monday, which is my weekend, which is not the best day to have a weekend on because everybody's doing stuff. But at least I'm not at work. Guys, hey, what's up, Vexer? Welcome in, Zeke Fox. Hey, Straight Tail, I see you. Zlephyr Blades, Shugaka, Negative Delta, Spaghetti Boy, Spaghetti Boy, Spaghetti. Caleb, I see you. D. Brendan, welcome in. Daskew. Blackjack Horse, I see you all the way up there. Guys, look over in the left here. Look right over here. Look at that. I caught me one of them pesky, hard to catch hyper sheep. I got one. I caught one. I'm gonna keep him in the jar. He's gonna be my little pet. Frederick Fox, thanks for the follow. Welcome to Floppy Flock. Welcome in. Scratch the Fur, thanks for the follow. Welcome to Floppy Flock. Welcome in. Zythes, thanks for the follow.
Thanks to @Tangerine Boost for my sub gift.
Dude, Zlephyr Blade coming in with the 2 1 sub for 3 freaking months. Zlephyr Blade, you're covered under colic here. From the blade's edge to the hilt, I got you covered. I don't know, what your sword? Zlephyr Blade, your sword? I don't know, maybe. Welcome in. Dude, thanks for the 3 months. Enjoy your, what is it, blue colored sheep now. You got a blue one.
Good to see you, Cinder.
Blackjack.
It's that time again. Time to play nerve pain or muscle pain. What is wrecking my back today?
Both. Probably both. I definitely know that. I get a lot of muscle pain in the back. I think I went through like 3 months of physical therapy this year, and it made a huge difference. Blackjack Horse coming with the 245 bits. Make a tuck stance. Look at that werewolf. USDA quality werewolf right there. USDA prime. Sorry. I'm not about to demote him down to quality. He's got to be prime. Desolate Space, thanks for the follow. Zila, thanks for the follow. Welcome to the Floppy Flock, guys. I am looking after the sheep. He's fine. He's got... So, look, it's okay. Am I going to... Do I have to put a sign up? Do I have to put a sign in his jar that says, like, it's okay, he's got his favorite music, he's got a bowl of water, the temperature is, you know, the AC's on, so you guys don't come in here and break my freaking jar. Do you know how hard it was to catch one of those hyper sheep? You know how hard it was? I'm not gonna let you come in here and ruin it. He's fine. He's got plenty of things in there to keep him comfortable. All he wants to do is run around. Dude, Blackjack. The best thing to do is rest. When I hurt my back, I did rest and then I stretched a lot. I did a lot of stretches, and then once I started getting better, I started doing strength stuff to strengthen it up. Air Arctic Wolf, come with the 300 bits, make a tuck stance. Look at that werewolf. Quality werewolf right there. USDA prime werewolf. VLNCL, thanks for the follow. Welcome to Floppy Flock. Why are all these sheep getting out? Because they're hyper sheep and they're super freaking hard to catch. You try catching one. You know how hard it is to get this thing? It's impossible. I had to like trick it. 14 werewolves? I wish. Fellas Draconis, thanks for the follow. Welcome to Floppy Flock. Cerulean coming with the 69. Nice.
Yabar dabadooba globba cow ow namak kalawoo.
Yeah, da ba da ba doo ba da. Thanks for the 69 bits, Cerulean. Nice. So guys, today we're gonna talk about shock. We've talked about shock before, all the way back in like August, I think it was. So we're gonna talk about it again because I've been seeing a lot of it recently. So we had a lot of sick people, a lot of people going into septic shock. So we're gonna talk about shock again. If you guys, who was here, put a 1 in the chat if you were here for the first time we talked about shock. Does anybody remember that stream? We were playing Surgeon Simulator 2, the second one, when we talked about shock. Beta, you were here. Air Arctic, you remember? Blackjack, you remember too? Rex, Collie. Look at you guys. Let's see how much you remember. Let's see how much you guys remember about what shock is, the different types of shock, and then here, okay, a test, quick test. I don't ever give tests. Pop quiz. Here we go. Pop quiz. What are the 3 types of distributive shock? Don't look it up. What are the 3 types of distributive shock? Who remembers? Not a test? Well, you guys are all failing. Beta Pup got 1. It's okay. If you don't know the answer now, you're going to learn. If you pay attention, you're going to learn. You'll learn. You failed. Can you go home now? Actually, you got to stay longer now. You got an F for find me after class. So I'm going to teach you a lesson about paying attention in class. Can I have cinder scotches instead of a test? No. Those are only for people who pass. And for me, because they're delicious. Ooh, hold on. That bass. Cardiogenic, septic, and neurologic. The 3 types of distributive shock: septic, anaphylactic, and neurological. Not neurological, yeah. Neurogenic. Neurogenic. Those are the 3 types of distributive shock, which is probably the hardest one to understand, so we'll talk about it last. But I gotta finish my coffee first. Pansalot, hey, what's up? Cinder's so small, he hides in plain sight. I'm not a very good hider. I always like you guys, when you guys used to like, okay, did you guys ever play hide and seek or like capture the flag or something where you had to try to hide from other people? Maybe this is just me. Whenever I would get like a really good hiding spot, I would get like super nervous and I always had to take a pee. So I would be like, I'd find like the perfect hiding spot. I'd get all cozy, right? Like in my little hiding spot, right? And then people would start running around and I'd start getting nervous and I'm like, oh crap, now I gotta pee. So then it's like you ruined the spot. The spot's ruined now because you gotta leave. I'm not a very good hider. I'm not that great.
Woohoo! Shazbot!
Shazbot! Woohoo! Rick, thanks for the host. Nah, man, I just hold it. I don't know, man. Sometimes it was like, I gotta go. It's like you're in the bushes, but then you don't want to like pee in the bushes because you're hiding in them, and that's just gross. Ugh. So you had to give up your spot, and you'd be like, hey, hold on, time out, I gotta go to the bathroom. And then your friends would tag you anyways, and you would lose. Unlucky Stick, thanks for the follow. Cedar Collie, thanks for the follow. Welcome to Follow Me Flock, guys. It sounds like poor planning on my part. Listen, Loam. I do not have control over that, okay? Sometimes your body is just like, hey, it's time to go pee. Also, Loam, Lemetheron, what's up, Loam? Loam. Guys, thanks for the hype train. Oh, God. The COVID, the Rhone. Guys, I've entered the Rhone zone. It's gotten me. It's what happens when you try to inhale coffee. Catheter and bag. What? Oh, you're talking about just putting, well, okay, I was like 8. Yeah, I'm not about to do that. That's 8. Although the idea of like going on a long road trip and having a catheter, like, you'd save so much time. Death by coffee is the way to go. Yeah. Actually, the way to go is in your sleep. If I'm gonna die, it's gonna be in my sleep or by my own choosing. I'd like to go in my sleep. I think we all would. Like, just give me like a ruptured aneurysm in my sleep. I don't ever go to bed, lie down. The pressure in my head increases because I laid down, and my aneurysm that was barely holding on at the age of like 89 just decides to blow. There you go. Nice and easy. Getting a catheter out sucks. Not as much as going in. Not as much as going in. You want to go while playing at a fur con, and you really don't want to do that, then you're going to make the news. Blackjack, I'll allow that. I mean, it happens. People with weak hearts. You can have a heart that's too sick for intercourse. It can happen.
Cinder 7 flop, Cinder 7 flop, Cinder 7 flop.
Dude, Grey Wing coming with the 2 months up for 2 freaking months. Hold on. Oh, excuse me. A little coffee decided to come on back up on there. Grey Wing coming with the 2 months up for 2 freaking months, dude. Grey Wing, you're covered under color care from Foss the Beans. I got you covered. Enjoy. You, what is it, green colored sheep now? You're uncommon sheep? Holy freaking crap, Scarface.
Everybody do the flop. Everybody do the flop. Everybody do the flop.
Dude, Scarface coming with the 5 gifted tier 1 subs on this community. Holy freaking crap, Scarface. 105, you crazy freaking madman. Or woman. Mad person. You're mad. Thanks for the 5 gifted subs, dude. Your support has been ridiculous. Thank you. Foxo Kaizo. Starless Snow Leopard. Kate Crochet, Raven, Wolfie, and Straytail, you're all coming under collar care thanks to Scarface for the floss of the beans. I got you covered. Go drunk skydiving? That sounds horrible. The last thing I want to do when I'm drunk is not have a firm, like, footing on the ground. Because let's be honest, it's hard enough to stand up when you're drunk enough, when you're past a certain point, right? I think the last thing I want to do is be plummeting towards the earth. It would be sick though. Yeah, it'd be sick, all right, because you'd be sick all over your face and the person behind you and pretty much everybody above you, and then eventually all that sick would follow its way down and possibly hit you on the ground. So yeah, go ahead, enjoy skydiving while drunk, and let me know how that feels when you know, vomit all over the place in 0G, or not quite 0G, but free fall. Let me know how that goes, just for, you know, I want to know for educational purposes. I want to know what happens when you vomit in free fall. Where does it go? I don't know. You're pretty good at standing when you're drunk to a point. Eventually you get to a point where you can't stand. Thus is the, you know, that's what happens with alcohol. Who's a good boy? I hope it's me. Oh, I hope it's me. Yes, you are. Oh, hell yes. Goddamn right it is. Thanks, Caleb. I thought the hyper sheep was a fly having a freak out over your Among Us collie. No. Okay. The oh, you're talking about this one over here. Yeah, he's fine. Ignore him. He's just in medical doing his tasks. Not sus at all. Definitely didn't kill 5 people already. Just doing my task in medical. That's all. Most certainly didn't, you know, most certainly I didn't rip someone in half. Didn't happen. I don't know what you're talking about. I was in medical. Spike the Snow Leopard, thanks for the follow. Welcome to Bobby Flock. Scarface, what the hell? Dude, Scarface gifted out 3 months of a tier 1 sub to Shugaka. Well, goddamn. Shugaka, you're coming under collar care for the next 3 months. From the flops to the beans. I got you covered. Shugaka, wait, Shugaka. I don't even, I feel bad. You're like you're a Digimon, right? That's your character? Right? Right? I think? I don't know. Oh, don't give me that look. I don't know. I'm not sure. You're making one, okay. Oh my God, Scarface. Scarface gifted out 2 tier 1 subs to the community again. Jesus. Haru Fox. Nazra, you're covered under collar care from Floss to the Beans. I got you covered. Thanks to Scarface. Scarface. Thank you, thank you, thank you, thank you, thank you. Thank you for your support. Seriously, thank you. You're crazy. Crazy. Kindle, hey. Welcome in. What's up? All right, guys. So we're gonna do the lecture. We're gonna do our classroom as we generally do, and then we're gonna get back into Quern. I don't know. Quern. I'm gonna call it Quern. We're gonna get back into Quern. Spike, thanks for the bid. You have a medical condition called crack-a-joke-itis? Yeah? I've never heard of it. Is it there with smart acidness? I think that's one I've heard of. Yay, learning. Yes. Okay, hold on. Let me move some stuff. It's related to your funny bone, which is not even a bone. It's a nerve. Scarface gifted out another tier 1 sub, this time to, oh God, Peter Rose, the protege, and you're coming under collar care from Floss and Beans. I got you covered. Thanks, Scarface. Again, you got 111 now. Ugh. Pederos? Is it Pederos? Peter Rose? I don't know. Pederos? How do you say that? All right, all right, all right. Let's learn. Just Pete, okay.
Me, rolls over to get water. My neighbors, what is that infernal screaming sound?
When you're laying in bed and you roll over and you're like, ah! You roll over to grab something. Blackjack coming with the 95 bits, talking about how he makes a horrible, horrible screaming sound. What are we learning today? We're learning about shock. But first... just keeps going. I actually got to turn on a fan. Hold on. Then we'll start. Then we'll start. For reals, we'll start. Hold on. It's hot in here. "30 minutes later, we finally start class. Look, you guys know that if the teacher shows up at least 15 minutes late, you're legally allowed to leave. The problem is I am the teacher and I'm always on time, so you know. Okay, get situated here. Okay, can I go home now? Hell no, we haven't even started yet. All right, okay. I'm messing with a few things. Okay, shock. So, when I refer to shock, we're going to be referring to what we call circulatory shock, right? I'm sure you guys have heard the term like, oh my God, he's going into shock, right? And it's like referring to someone who maybe like got into an accident and doesn't feel much pain. That's not exactly what we're going to be talking about with shock. That's more of like an endorphin rush. It's your body's way of trying to protect yourself from any kind of severe traumatic injury or anything like that. When we talk about shock, we're talking about circulatory shock. Circulatory shock is defined as a life-threatening clinical condition caused by body-wide deficiency of blood supply. Cerulean, are you late? No, we just started. You brought coffee and a Chicago-style hot dog. Place it on my desk and go take a seat. And I'll just take care of that real quick. Love me some hot dogs. So, circulatory shock, a life-threatening clinical state caused by a body-wide deficiency of blood supply. This causes oxygen deprivation, a buildup of waste products, and eventually organ failure if left untreated. There are a couple ways that shock can occur. There's 4 specific types that we're going to talk about. Hypovolemic shock, all right, cardiogenic shock, obstructive shock, and distributive shock. Within distributive shock, there are 3 subtypes of that. You have septic shock, anaphylactic shock, and neurogenic shock. All of these subtypes of shock, all of the things we're going to talk about, end with the same goal, which is a drop in blood pressure, which causes a lack of perfusion throughout the body, right? So a couple things we need to talk about first, all right? When we talk about blood pressure, we're referring to the amount of pressure that your blood is pressing on your arteries within your circulatory system, okay? We measure this in millimeters of mercury. Normal blood pressure is 120/80, all right? 120 systolic, 80 diastolic. The difference being is the 120, your systolic, is the amount of pressure that's put on your arteries with each heartbeat, so the maximum pressure. Your diastolic is the minimum amount of pressure that's exerted on your arteries at any given point during the heartbeat. So 120 over 80 is perfect. But physics tells us if we widen or increase the volume with the or increase like the size of the tube, right, with the same amount of volume, our pressure is going to go down. So say you have an artery that looks like this, and an artery that looks like this. This is going to have a higher pressure, and this is going to have a lower pressure if you have the same amount of volume, right? Because more volume or the same amount of volume in a tighter spot is going to push back harder as opposed to the same amount of volume in a wider space or a bigger space is going to push back less. Okay? This is an important thing to understand. This would be what we call vasoconstriction, or constricting or a narrowing of the blood vessels. This is what we call vasodilation. When your veins and your vessels and your arteries open up, they get bigger, right? There are a couple things that can affect this, all right? But these are important things to understand if we're going to talk about shock, because shock is pretty much just our body's way of, or what happens when this system kind of fails, okay? If you do not have a high enough blood pressure, so say your pressure's like 60 over 30, right? Which this is bad. You are in tough shape here. If you do not have a high enough systolic pressure, nutrients and oxygen and other things cannot get through the veins. You need a certain amount of pressure for perfusion to happen, what we call perfusion, as that oxygen perfuses out of the veins and into the tissues that require it for functioning and for energy, right? So if you have too low of a blood pressure, what happens is your perfusion drops, which means that you start to deprive your cells and your organs of oxygen. Does that make sense? Before we move on, is you have to understand this key concept of when your blood pressure drops, your perfusion goes down, which means less oxygen being delivered to the organs and to your tissues, which eventually leads to organ failure and organ death. Dude, Narf dog, what's up? It's a flop dog. Narf. Yeah. Okay. Any questions about blood pressure and perfusion and how that whole idea of vasoconstriction and vasodilation works? As the veins get bigger, the pressure drops unless you have a continually increasing amount of volume, right? So you can fix vasodilation with enough volume. You give enough volume to start filling those tubes, right? You can bring the pressure up because more volume in the same space equals higher pressure. Rolls-Royce doesn't make cars anymore. The Rolls-Royce Motor Company is licensed under BMW. Bubba, was there a reason for that fact? Okay, thanks. I did think about getting a Mini Cooper at one point, but now that they're BMWs, they're super expensive to maintain. That's what makes someone faint, right? Well, fainting can be caused by a couple of things, right? Losing consciousness, or what we call syncope, which is like a loss of consciousness or passing out. Typically speaking, it's going to be caused by pressure changes in the brain, because if you don't have enough pressure to get blood to the brain, your oxygen starts to deplete in your brain and then you pass out. A couple things can lead to someone passing out, right? Syncope has a number of causes. Some people have syncope when they poop because that motion or that action of bearing down to defecate, right? It's what we call a vagal maneuver, when you bear down. And what that does is it triggers, I think it's your vagus nerve in your chest, which actually slows down your heart rate. So some people who maybe have low blood pressure, if they bear down too much, say if they're constipated, they can actually pass out on the toilet. Vagal syncope. Scrubs made fun of it, because I think JD had it in Scrubs, because he would always take his pants off when he pooped and his neighbors found him naked, passed out on their toilet. The vagus nerve? I believe that's what it is. Okay, so types of shock. Before we get off topic here, let's talk about shock. So let's talk about the easiest one to understand. What do you think we refer to when we say hypovolemic shock? Scarlet Derby, come with 100 bits.
I liked your discussion on lymph nodes a couple of days ago. I also like how your totes adorbs little bitty puppy whoppers.
Little bitty puppy whoppers. Scarlet Terry coming with the 100 bits, making tuck stance. I appreciate the compliments. I'm glad that you learned. Loss of blood, lack of volume, lack of blood pressure, too much volume. Actually, it's too little. Remember, so Rex, remember, hypo refers to low, hyper refers to high. So if it was hypervolemic shock, which is not really a thing, that would be too much volume. But hypovolemic shock, you have too little volume, all right? Too little volemic volume and then shock. So actually, I forgot to touch on something real quick before we go into hypovolemic shock, but we can talk about it now. This diagram here, you're going to see this diagram over and over again during this lecture. Okay, this is our circulatory system. We've talked about the circulatory system a lot of times. We've talked about it quite a bit. I've talked about the heart a lot. I've talked about how blood flows through the body, right? But as a quick reminder and a quick touch up on how this happens, because it's going to be relevant for today's lecture, we're going to just take a look at this diagram. So you have your heart here, right? Your heart's job is to pump blood. That is its only job. It does not handle emotions. It does nothing else. The heart wants to do one thing and one thing alone, and that's pump blood. And it does it pretty damn well. So your heart's here and pumping blood. We'll start with the blood flow of the flow of blood through the body at the right atrium, okay? Which is this part right here. Blood flows from the right atrium down into the right ventricle and out to what we call pulmonary circulation, right? So this blood, which is deoxygenated, it does not have any oxygen to it, goes to the lungs to receive oxygen. It then returns from the lungs back through the pulmonary vein into the left atrium, down into the left ventricle, and out to systemic circulation through what we call the aorta, and down to the rest of your body where it hits these capillary beds, okay? We've talked about capillary beds before in the past as well. They're the smallest veins in your body, the smallest arteries in your body where gas exchange and nutrient exchange occurs, okay? We call those the capillary beds. The blood drops off its oxygen, picks up everything else, carbon dioxide, all that stuff, all the waste products, and returns to the heart back where it started in the right ventricle. That is the circuit of blood through the body, okay? So hypervolemic shock. Hypervolemic shock occurs when you just don't have enough volume. This can be related to external or internal bleeding. So say you have a traumatic injury, right? Say you lose a limb, or something happens and you sever one of your arteries, one of your major arteries, like your femoral artery or your radial artery, right? And you start bleeding. You start losing volume. You can even have internal bleeding. Things like a ruptured blood vessel, like an aneurysm, right? So if you have, say, an aortic aneurysm, something like this, right? In your aorta, which is the massive artery running through your chest. Sometimes these can rupture and you can get internal bleeding, which would lead to hypovolemic shock. Because eventually you're going to lose enough blood that your blood pressure is going to drop, and you're going to have that, what did I say? That was life-threatening clinical state caused by body-wide deficiency of blood. That is going to eventually happen if you rupture your aorta. So hypovolemic shock usually as a result of an external trauma or some kind of internal bleeding. All right, but you can also get this, say, with like a burn. Say someone who has a pretty significant portion of their body's been burned, and burned badly enough that they're losing fluid out of that burn, right? Because remember when we talked about burns, a lot of times when you get burned, you'll lose body fluid. It seeps out. Some of that interstitial fluid starts to seep out because your skin is so damaged. So people who have massive burns that cover a good portion of their body could be at risk for hypovolemic shock. So you need to make sure you hydrate them, right? People who have excessive vomiting or diarrhea or urination. Say you have a patient who's got C. diff, which is a bowel infection, right? Causes uncontrollable diarrhea. You can go into hypovolemic shock from that. Say you have a patient who's in diabetic ketoacidosis and their body's trying to cure that or fix it with excessive urination. Or you have a patient who is an SIADH, which is syndrome of inappropriate antidiuretic hormone, which causes you to pee a lot. You can have these patients go into hypovolemic shock as well due to their excessive urination. And then say if you have someone who's got like some kind of stomach bug or something's going on and they're just vomiting a ton, you're going to lose fluid through that as well. So anything that's going to cause you to lose fluid has potential for putting you into hypovolemic shock. You can poop yourself to death. You absolutely can. Snowy White Fox, hey! What's up, Homer? Welcome in. We'll talk about some of the signs and symptoms of shock once we get through the different types of shock. So I'll talk about some of the things that you would expect to see with patients who are in shock. But hypovolemic shock is going to usually refer to something, or usually going to occur from some kind of bleeding or some kind of massive fluid loss that causes you to lose enough volume in your blood to cause that body-wide deficiency of perfusion, that body-wide decrease in perfusion, which eventually leads to organ death and eventually death. So if hypovolemic shock is a problem with the amount of volume, what do you guys think cardiogenic shock is? What do you think's messed up with cardiogenic shock? Weak heart in the heart no beat good. The heart no beat good. We got to make it beat good again. Your heart no beat good. Yes, it has to do with your heart. So if we want to think of this as a closed system of pumps and pipes and tubes and water, right, or volume, this is a lack of water with hypovolemic shock. This is a mess up with, this is the pump breaking down. So cardiogenic shock is going to occur when you have the heart, when the heart is unable to effectively do its job, right? What do you guys think could cause the heart to suddenly become incapable of pumping blood? There's a couple things. There's a very easy one that's very straightforward. What do you guys think of? What could cause the heart to screw up? How about a heart attack? Being eaten, Cedar Collie? I think cardiogenic shock is the worst, the least of your concerns if you're being eaten. Death? Well, yeah, death would cause your heart to stop, yes. A heart attack. Perfect example of something that's going into cardiogenic shock, right? If you have a heart attack, specifically a big enough heart attack that kills or atrophies enough of that muscle, your heart can no longer perform its job, and you either rush to cath lab and get saved, or you die. Because you go into cardiogenic shock because this pump no longer works. So you have the right amount of volume in your blood, but you have no way of moving it around. Thus, you get a decrease in the perfusion throughout your body, because if you can't pump blood, you can't bring oxygen you can't actually have perfusion without blood moving. Plus, as your heart stops, with your heart goes your blood pressure. If your heart stops, your blood pressure is sure as hell going to tank because nothing's moving and you die. And with no pressure, you can't have perfusion. Even if you did get oxygen there, you don't have the pressure to perfuse it out. Some other things that can cause cardiogenic shock. Anybody know what cardiomyopathy is? We've talked about it before in the past. Dakota Fox, thanks for the follow. Hanzaki, thanks for the follow. Welcome to Floppy Flock, guys. Akita Opal, thanks for the follow. Welcome to Floppy Flock. Oh, excuse me. Not enough oxygen. Cardiomyopathy. It's a dilation of that muscle. A dilated cardiomyopathy. This is a perfect example of what can happen. If you overwork your heart, so if your blood pressure is continually high. Hold on a second. Okay. So dilated cardiomyopathy. If your blood pressure is continually high, or you have to put extra strain on your heart, typically for like having blockages or some other things that can cause strain on the heart, like any other muscle, your heart's going to grow bigger, right? And what happens with your heart is instead of it getting better at actually doing its job, it just balloons out. And you get this cardiomyopathy, right? This heart cannot pump as effectively as this heart. Thus, your blood pressure starts to drop. And if it starts to get really bad and strained, eventually you can go into cardiogenic shock. A couple other things that can cause you to go into cardiogenic shock. If you have any issues with your heart valves that cause some kind of malfunction or inability of your blood or of your heart to maintain its cardiac output, right? To maintain the amount of blood that it normally pumps out. Myocarditis, which is an infection of the myocardium, can cause cardiogenic shock, and specific heart arrhythmias, things like VFib, right? And VTAC, things that cause arrhythmias that cause the heart to be unable to maintain that amount of pressure that is required for perfusion to occur. I feel like I'm back in middle school biology class. I hope you're learning. You gotta be learning. What causes WWE wrestlers die from enlarged heart syndrome? Well, bodybuilders and people who are like super ripped and strong, like I think of like massive bodybuilders, your heart doesn't know the difference between fat tissue and muscle tissue. All it knows is more tissue requires more pressure, which requires more work, which is why you'll hear about people who are bodybuilders dropping dead from heart issues, even though you'd think they're healthy because they're, 350, 400 pounds of pure freaking muscle and they look like a superhero. Unbeknownst to them, their heart has actually dilated and gotten bigger because your body doesn't know the difference between muscle and fat when it comes to, perfusing. It just knows more tissue equals more pressure, which means more work for the heart. I can never spell arrhythmias right. Okay. I can never spell arrhythmias. I can never spell rhythm right. I just, every time I do it, I always forget. What do you guys think obstructive is? What's obstructive shock? It's pretty straightforward. It's right in the name. What do you guys think happens in obstructive shock? You guys are right. Hold on. You're right.
Me, doing stretches and using muscle roller. My neighbors, we seriously need to call an exorcist.
An exorcist? Don't you wish they could just, go in there with a scalpel and take your muscles out of your neck and just stretch them out really far and then just put them back in there? I want them to do that to my back. Just get in there and just cut those muscles out and then just stretch them like you would a rubber band and just put them back in. Just stretch them out for me, please. Arrest Nocturna, thanks for the follow. Welcome to the Floppy Flock. So yes, you guys are all right, by the way. Obstructive shock. In obstructive shock, we're referring to a blockage or some kind of something that impedes the blood flow through one of the major circulatory circuits, right? So this isn't just like say you get a blood clot in your leg doesn't lead you to get the obstructive shock, right? Because remember, a part of shock is having body-wide deficiency of blood, body-wide decrease in perfusion, right? That doesn't occur with a small blood clot down in your leg. But where it does occur is, say, a blood clot in your lungs, Actually, I don't want to use that color. Let's use or a blood clot somewhere in your aorta, right? Something that's going to cause a system-wide, a body-wide deficiency of blood, right? When you get a blood clot in the lung, what do we call that? What do you call a blood clot in the lung? Death? Yeah. Oh, for a lot of people, yes. A pulmonary embolism, a PE. We call it pulmonary embolism. So when you get a blood clot in the lung, say in one of these major arteries, that blocks blood flow to the lungs, which leads to decrease of oxygenation and can just straight up just kill you. People will just drop dead from a pulmonary embolism. Okay. Some kind of obstruction in the aorta would be exceedingly rare. I can't say I've ever seen it or even heard of somebody having a big enough clot to obstruct their aorta, because it probably would have gotten stuck somewhere else along the heart, but it can happen. But a couple of other things that can cause obstructive shock that you might think seems a little weird. So hold on, let me do. Is it UM or IM? Embolism. I think it's just lism. Embolism. Something like that. There we go. Good enough. What about cardiac tamponade? We've talked about cardiac tamponade before. When you have fluid buildup around the pericardium, which is the sac that the heart sits in, that compresses on the heart and obstructs it from doing its job. Technically, cardiac tamponade, which eventually leads into, or like pericardial effusion, which leads to cardiac tamponade, which is the worst of the two. You have enough pressure built up around the around the heart to actually obstruct it from doing its job, right? So cardiogenic shock usually refers to something wrong with the structure of the heart, right? Something that's messed up the pump itself is broken. Cardiac tamponade goes under obstructive shock because you have fluid that is obstructing the heart from doing its job. So thus it becomes a part of the obstructive shock. All right. Cardiac tamponade, just buildup of fluid around the heart. Okay. Another way to get obstructive shock. How about a collapsed lung? You're obstructing that lung's ability to inflate and deflate, right? Also considered part of obstructive shock, a deflated lung, a pneumothorax as we call it. So before we go into distributive shock, let's kind of touch base on what we've learned so far, okay? Hypovolemic shock is going to refer to a drop in volume, whether that be to internal or external bleeding or some other way of losing volume, such as excessive urination, diarrhea, vomiting, or fluid loss, say after a major burn. This lack of fluid and this drop in volume of blood causes you to decrease your blood pressure, which decreases perfusion, which leads to shock. Cardiogenic shock refers to something going wrong with the actual structure and the function of the heart. So think of this as a damaging of the pump itself. This can be a heart attack, which actually damages the muscle. Cardiomyopathy, which is a dilating of the muscle, causing it to pump less effectively. Specific arrhythmias that mess up the heart's coordination, and myocarditis, which is an infection around the heart that can cause issues with its ability to beat. And then obstructive shock, which has to do with a clot somewhere or a blockage somewhere within the pipes that prevents blood from flowing. This can be caused by either a pulmonary embolism or some kind of clot in the aorta, or even something like cardiac tamponade, which has fluid obstructing the heart's ability to pump, or something like a pneumothorax or collapsed lung, which is obstructing the heart's, which is obstructing the lung's ability to actually function, which obstructs blood flow.
Oh crappy late to class.
Metalworking coming with the tier 1 stuff for 3 freaking months. Metalworking, you're coming under colic here from the iron to the copper. I got you covered. It's okay, you're late. I'm only just gonna call your parents and let them know that you are late. Ooh, you're gonna get in so much trouble. Derek Kazan, thanks for the follow. Welcome to the Floppy Flock. Too soon, dude. Take care. What do you guys think happens in distributive shock? It's gonna scream, just gonna call their parents and be like, and they're gonna be like, what the hell? Distinctive shark. Yeah, I know, my handwriting's bad. Distributive shock. So, distributive shock has to do with the capillaries. So if we've had issues with the pump, we've had issues with the volume, we've had issues with the tubing.
Cinder's called.
Your child was late. There's just a laundry list of reasons for this shock. There is. It's also the most complex and actually the most common as well. So distributive shock. What happens in distributive shock is you have a dilation of the blood vessels from something. What we call vasodilation. Remember we talked at the start of the stream or at the start of the lecture about this idea that as your veins dilate, your pressure drops.
Cinder is cute. Cinder can be sus. Let's blame all the kills on Banana Head, sus whiskey and Otter Jam. Best Jam Otto Jam gives pets. Also Phoenix in the chat. Go scree.
Tommy, I disagree. Rat Jam is the best. I am a Rat Jam fan. Thanks for the 50 bits. I appreciate it. So at the start of the lecture, we talked about the idea of vasodilation. As your veins and your arteries dilate with the same amount of fluid, your pressure drops. Okay. What you're going to have in distributive shock is you're going to have a system-wide, a body-wide vasodilation. Okay. So something happens in your body that causes all of your arteries and veins to dilate. Thus, your systemic circulation, the systemic pressure drops, and you get into that system-wide clinical state of having decreased blood flow and decreased perfusion throughout your body, which eventually leads to organ failure and death, known as shock. The three main things that cause this, so the three things that we're going to talk about with this: septic shock, anaphylactic shock, or anaphylaxis, or anaphylactic shock. I gotta look up how to spell anaphylaxis. And neurogenic. Who knows what sepsis is? Who knows what sepsis is? Has anybody ever been septic? Have you ever been septic? Do you know have a loved one who's been septic before? Cinder Jam when? At some point. Blood poisoning? It's a good way to put it. Something with infection, blood is poisoned. It's so the technical term for sepsis or a septic infection is an infection that infects two or more body systems. Okay, so if you have an infection in your skin and say it gets down into one of your organs, you're now septic. Most commonly though, we refer to it as a infection that has gotten into the bloodstream. So if you are septic, more than likely you have bacteria in your bloodstream where it shouldn't be. We talked about the lymphatic system and how the lymphatic system helps suck up all that extra pathogens and kind of sorts it out. Sometimes you can get infections that go straight into the bloodstream. This becomes a septic infection. Okay, when you have a septic infection and it gets bad enough, your immune system becomes overrun by the infection and it creates what we call a cytokine storm. If you've ever heard, I'm sure you guys have heard recently about cytokine storms, because that's what's killing people with COVID, is that release, that massive release of cytokines. Okay, cytokines are your immune system's kind of like, it's almost like an alarm system. It's like a warning call, right, to pull other immune cells into that area. But what it does is it causes massive vasodilation, and it causes leakage of the capillaries. Because if you have an infection, you want vasodilation so you can have more white blood cells getting there, because you can have the wider and the more dilated the veins, the more blood it can hold, which means more white blood cells, which means better infection prevention and infection fighting. But you also want those veins to become leaky so those white blood cells can actually leak out of the veins and into the tissue where the infection is occurring. This system works great when you have a localized infection. When you have a septic infection, which is in the bloodstream, this happens all throughout your body. And essentially what happens is you have this massive vasodilation with these leaky arteries and veins, and all of your fluid leaves your bloodstream and starts going into your tissues, and you go into septic shock. So this is caused by an infection that causes massive vasodilation, which causes a drop in pressure and a decrease in perfusion. What's anaphylaxis? Has anybody ever had an anaphylactic reaction or ever gone into anaphylactic shock? This one's pretty straightforward. You probably know what this is. What causes anaphylaxis? Allergies. These two are very similar in the way that it causes your body to go into shock. Anaphylactic shock is caused by an allergen. What happens is your body overreacts to that allergen and releases massive amounts of histamine. Histamine works very similarly to cytokines in the sense that it causes vasodilation, which is why if you have allergic reactions, say if you're allergic to like pollen or like dander, like cat dander or dog dander, that's why your nose gets all stuffy, because that dander causes a release of histamine in your nose, which dilates the vessels in your nose, which causes all of this fluid to rush up in there, which causes that fluid to leak out into your nose, and now you have a stuffy nose. That concept, when you go into anaphylaxis, happens all throughout your body. You get vasodilation, which causes all of those, it causes the fluid in your entire body. That massive systemic vasodilation causes all of those veins and arteries to open up, which then causes a drop in pressure, which causes a drop in perfusion, which eventually leads to organ death, and eventually death, which is what we call shock. Any questions on those two? Very similar kind of mechanisms of action, or end results at least, with different triggers. Septic infection or septic shock coming from a bacterial infection, which causes a cytokine release. Anaphylactic shock, which comes from an allergen causing a massive histamine release, both of which cause massive vasodilation throughout the body and eventually a drop in pressure and a drop in perfusion. So how does the EpiPen or adrenaline injector stop that? Adrenaline is a vasoconstrictor. So you give the vasoconstrictor, which causes all your veins and arteries to constrict, which causes your blood pressure to go up, which prevents you from dying. What's perfusion? Perfusion is your body's ability, it's the oxygen and nutrients ability to get out of the veins and go into the tissues. It's what we call perfusion. If your pressure is too low, perfusion cannot occur. Without perfusion, you die, because you have no way of getting oxygen and nutrients to the cells that require them, and you have no way of getting blood or waste products back into it, which eventually leads to your cells dying if they don't have the nutrients and oxygen required to function. Is that the same as what happens to most people that have peanut allergies? Peanuts are probably the worst offender of anaphylactic shock. There's a protein in there that our bodies freak out about. Pally K, you'd be correct. Neurogenic shock. This is usually the result of a spinal cord injury. Do you guys remember when we talked about the nervous system, we referred to the sympathetic nervous system? So within your nervous system, you have your autonomic nervous system, which was responsible for all the automatic kind of non-voluntary functions of your body, such as regulating blood pressure. Specifically, your sympathetic nervous system, which is responsible for keeping your vessels constricted, right? What can happen in neurogenic shock is if you get a spinal cord injury or some kind of damage to the brain, it can cause this sympathetic nervous system to stop working. And thus you have no way of causing vasoconstriction with your normal way of doing it, which would be through your sympathetic nervous system. When that shuts down, you lose that ability to constrict your veins, so your veins just start to dilate because you have no way of constricting them on your own, and then you go into shock. Because as you continue to dilate those vessels, pressure is going to drop, perfusion is going to drop, and eventually you're going to die. So distributive shock refers to a massive vasodilation or an excessive dilation of the blood vessels, either related to a septic infection, anaphylaxis, or some kind of neurogenic issue such as a spinal cord injury. Any questions on the types of shock before we talk about the signs and symptoms and the treatments? What did I miss? I missed the question. Hold on. Cerulean, what'd you ask? Can histamine cause gastrointestinal distress, like acid reflux that feels like fresh, chunky lava? I know certain food allergies can cause a lot of gastric discomfort. I'm not 100% sure if histamine directly affects that or not. I don't know. You can ask Google. Google might be able to tell you. How often do you stream? Usually like 2 to 3 times a week, depending on my work schedule. I don't have a set schedule because my work schedule isn't set, so I stream on days that I don't work generally, with some exceptions on days that I take off for my own personal well-being and because I don't have to do this for a living, so I can take streams off whenever I want. But most of the time, it's usually about 2 to 3 times a week. I start at 2:30 p.m. EST because I live in the eastern part of the United States. Sean DeLay, hey, welcome in. Any questions about the type of shock before we talk about the signs and symptoms of shock? Does magnesium, potassium being high-low affect this constriction of the muscles? More so, I think potassium and magnesium are going to mess with your heart rhythm more than anything else. Especially potassium. Low potassium is going to make your heart too spastic. High potassium is going to stop your heart. Potassium works to relax muscle. So if you have too little potassium, your muscles become too spastic, which means you can go into abnormal heart rhythms like AFib, A-flutter, VFib, VTAC, those types of things, right? Because your heart can't relax. If your potassium level's too high, your heart can't pump because the muscles are too relaxed. Part of the way that you do, they do capital punishment when they do the death penalty is they give you a combination of a sedative, it's a sedative, a paralytic. Is it a paralytic? No. It's a bunch of sedatives and a high dose of potassium, I believe. So they sedate you and then they stop your heart. So I always remember potassium relaxes muscle. Low potassium, your muscles tense up and become too spastic, which is why you cramp out after a good workout. High potassium slows your heart. Magnesium deficiency can cause a lot of other issues. It can also cause issues with your heart rhythm, and it can actually throw you into specific heart rhythms, things like torsades de pointes, which is usually related. It's a type of VFib, which is related to potassium levels. It can also cause your eyelids to like, you get like the quivering of your eyelids. You get like the eyelid twitch. Sometimes that can be caused by potassium issues. Ambi, what are you WTFing about, huh? Huh? It can cause cramps as well. Body's sensitive. I'm scared to die. Your body's extremely sensitive. You guys have no idea how both resilient and weak our bodies are. I have seen some people put their bodies through hell and back and they're somehow still breathing. And I've seen people do everything right and still die from something that they had no control over. We literally, some of our frequent flyers in the emergency department, they're like cockroaches. No matter how drunk they are, no matter how badly they're in DKA, no matter how sick they are, They just keep freaking living. And then you'll get like the people who are freaking like marathon runners who are in their 60s and have some kind of crazy cancer that's going to kill them, right? Like I've seen everything in between. It's ridiculous. Some people are just, our bodies can be extremely resilient and can deal with a lot, while at the same time they can be taken down by something very insignificant. It's the definition of a coin flip. It really is. And the only thing you can do is try to take care of your body by eating right, working out regularly, seeing your doctor when you have issues, right? Taking care of yourself is the best way to hedge your bets to give yourself the best opportunity. Don't wait until things become emergencies, because when they become emergencies, it's harder to fix them. And sometimes we can't always reverse the effects. So if you're having issues, you should see your doctor, because you only get one body. Some of you guys, some of you guys treat your body like you could just buy another one. You can't. It's not going to happen. Some of you guys treat your car and your house and your belongings better than you treat your body, which is stupid, because none of those things are going to matter when you're dead. Has anyone ever died of laughing? I'm sure somebody in the history of our existence has died of laughing. I plan to live forever. When I'm 130, Projans will be a thing. Yeah, good luck. Nobody lives forever. We're all gonna die. You might as well just enjoy it while you have the chance. Unless they're cybernetics. Wait, you really think we're gonna get cybernetics? We couldn't even agree on stem cells, which are not even cybernetics. We couldn't even get stem cells to be researched. You think they're gonna let us put cybernetics in people? Yeah, good luck. Yeah, not in our lifetime. Can't buy a new body when you can buy THC. I mean, plus, you don't want to live forever. Let me tell you, your body will eventually break down. For most of us, it's going to be between 70 and 90. Some of us will get lucky and live to 100. But eventually, everything's going to break apart. And you just hope that your brain is the last one to do it. You're going to get a robot heart and live forever? Yeah, that's great. But a robot heart's not going to keep your brain from atrophying, or keep your kidneys from shutting down, or keep your liver from shutting down. Robot heart, great. Some people have those. They're called LVADs. Hold on, before we talk about signs and symptoms, some people have that. You guys ever heard of an LVAD? We already have people with mechanical hearts. It's called a left ventricular assist device, or an LVAD. It's a mechanical heart that you wear for people who have very, very, very sick and diseased hearts. We can bypass it. This is actually super cool. These patients don't have a pulse because there's no heartbeat, because everything's driven by a pump. So they have no pulse. They also, their blood pressure, you only get one blood pressure. You only get like a one number. You don't get a diastolic and you don't get a systolic and a diastolic. You just get one. Really interesting. I've seen a few of these in my life. But yes, you can have a mechanical heart. Who said that? Who actually wanted the mechanical heart? Who was that? Cedar Collie, you can have a mechanical heart, but it ain't going to prevent all your other organs from shutting down. How do they handle exercise or sleep? You adapt. I don't know what their exercise protocol is. I don't work in perfusion. I'm not a perfusionist. I don't know what their exercise program is like. Might as well replace the whole thing with mechanical parts that can be quickly upgraded and replaced if we ever get that far. Bojack!
Knowing my luck, my brain will be the first thing to go. Just a constant train of dial tone.
That's what you hear for the rest of your life. How about mind uploading? I don't know, man. I have no idea. If I'm at the end of my life and they tell me I can load up my consciousness into an AI program, sure, why not? Let's go for it. Okay. So signs and symptoms of shock. Well, obviously the most important one that you're going to see. Low blood pressure. Because that's what causes shock. Is low blood pressure, which is which causes a drop in perfusion. So that's going to be like your first sign, right? Typically what comes associated with low blood pressure is high heart rate. Some cardiogenic shocks might not have this because the heart's actually damaged, but most of the time if your blood pressure drops, your heart rate's going to go up to compensate for that drop in pressure. So if each beat of the heart causes is causing a lower pressure, right? So if say you do 20 beats of your heart, right? And before whatever happened, your pressure was at 120 over 80, but now you do 20 beats of your heart and your blood pressure is at 90 over 60, your heart rate's going to increase to say 30 or 40 to make up for that difference, right? So you're going to have a drop in blood pressure with a compensatory mechanism of an increased heart rate, what we call tachycardia, okay? You're also going to have an increase in respiratory rate. There's a reason for this. As your body starts to go through shock, your blood becomes more acidic. And when we talked about blood gases, we talked about the fact that one of your body's ways of maintaining the pH balance in your blood is through your respiratory drive. You breathe out carbon dioxide. If your blood becomes acidic, one of the ways that your body's going to compensate for that is going to increase how often you are breathing out, which is going to increase your respiratory rate. That way you can clear out all of that extra carbon dioxide, thus maintaining that level pH balance. Why does your blood become acidic when you're septic or when you're in shock? Does anybody know why your blood becomes acidic when you go into shock? I would be very surprised. There's a specific lab test that we look at, a specific type of acid that we look at for patients who are in septic or who are in shock. Too many lemons. Not quite. An ugly hyena, yes! Yes! Lactic acid! But do you know why? Do you know why you get a buildup of lactic acid? That's the real question, is do you know why you get a buildup of lactic acid? Yainsy! What's up, Yainsy? I hope you're well. It was cool seeing you in VR the other night. It was nice to like just jump in and go like, ah, and then leave. Carbonic acid? No. It's lactic acid. Muscle spasm? Not quite. Loam, you're like, you got the idea. And it's not quite your heart. It's not just your heart, Loam. Your entire body starts using anaerobic respiration. So there's a difference between anaerobic and aerobic respiration, which we'll get to in a second. Hold on. Oh god, I screwed it up. I put it in E. Jame. Chicago. Yeah, Squirtle Jame. Good one, Cinder. Good job. I bet I know the difference between a cold and an allergy. You might not be able to tell the difference. Okay, so when your body is getting enough oxygen, your cells use aerobic respiration, which is a way of breaking down oxygen into energy, right? When you do not have oxygen and you have a decrease in perfusion, especially a system-wide one, your body starts using anaerobic respiration, all right, or anaerobic metabolism, right? It starts to break down glucose only partially because it can't break down, it can't use the oxygen that it normally does. It starts to use glucose instead, and as it breaks down glucose, it produces lactic acid. As more and more and more of your cells become starved for oxygen and resort to this alternative way of energy, more and more lactic acid is going to build up, which is going to cause a decrease in your pH, which is going to cause your body to become more acidic, but your body's going to compensate with an increased respiratory rate. So I'll put on here, we call it lactic acidosis, which is secondary to that anaerobic metabolism because of that lack of oxygen. Okay. You can also start to see signs of organ damage, things like confusion or altered mental status. We'll say AMS, right? As your brain starts to become starved for oxygen and your brain starts to die, you start to become altered. Don't know where you're at. Don't know what's going on. Maybe you become combative. Maybe you're just lifeless, unresponsive, right? You can start to see decreased urine output. Although usually we don't use decreased urine output as a way of determining if someone is in shock because there's enough other things to look at. But decreased urine output, because as you're getting less and less blood flow to the kidneys, they're going to start putting out less and less urine. Okay. You're also going to see a drop in cardiac output. Right? And that could be either from the damage of the heart, the lack of volume, the vasodilation, or some kind of blockage that decreases the amount of blood that the heart can actually pump out. All right. You can have changes in your skin color. That looks like muddled. Who knows what mottled skin looks like? Has anybody seen anybody modeling before? Or what mottled skin looks like? It kind of looks like cyanosis. You get this weird kind of like marbling effect. This purplish modeling. I always thought it was, is it tea? Is it actually tea? It is tea, isn't it? There you go. Look at that leg. This is what we call modeling. This is not good. This is not good. This is a result of a drop in blood pressure, which just kind of causes all that blood to just sit there. And you get this marbled looking, mottled look. We see this all the time. It's bad. You can see this with children, especially little babies, if they have any kind of circulatory issues. And you'll see this in your septic patients as well. That's not good. Can that cause clots to form? It sure can. You can also have red flushed skin, depending on the type of shock that you're in. Especially like distributive shock, because you're getting a lot of that fluid leaking out into the capillaries or leaking out from the capillaries, you might get red flushed looking skin, right? Your mottled skin is typically going to be more for like your volumetric or your hypovolemic, or your like we'll see that with septic shock a lot too. But for some septic shocks, and especially like anaphylaxis, you might see some red flushed skin. That's not good. Are seizures O2 related? No. Seizures are related to a firing of neurons in the brain when they all start firing at the same time. Can we get some Cinder G's in the chat? Write that down. Write that down. It's not good. It's not good. I thought most went white when in shock. They can. Their skin can be cold. Their skin can become cold and clammy and sweaty. They can go pale. They can have mottled skin. They can have red flushed skin. It depends on what is the underlying cause of their shock. That's no bueno. Also, do you guys like the new? We got all these new animated emotes. We got Cinder Soap, Cinder G, Hyper Sheep. I updated the Pogger Spin. We got some new emotes. It's smoother now. It is. A couple other things that you could see with this as well. just from like a blood work standpoint. An increase in creatinine. Creatinine, INE. And you might see an elevation of their troponin as well, if it's related to their heart. Creatinine is a byproduct. It's a waste product that your kidneys excrete. If your kidneys start to fail, your creatinine is going to rise. If your heart gets damaged, your heart's going to release troponin, which is an enzyme in cardiac muscle that can get into your blood when there's damage to the heart. So what do you guys think? How do we treat shock? What do you think the #1 treatment for shock is? It's easy. Elevate the legs. I mean, not my first intervention, but probably something I would do eventually, but definitely not my first. Blucher, you're right for all of them. Fluids. We pump these patients full of fluid. If we can increase your blood pressure, we can increase perfusion and get energy and resources back to those organs that so desperately need them. Fluids. Yes, you can do vasoconstrictions and vasopressors as well, but the #1 thing you are going to give a patient who is in shock is fluids. As much fluids as you can. For us, our protocol, 30 mLs per kilo. So for example, let's take a look. Let me get a calculator. Let's figure out how much I am. So I am 160 pounds divided by 2.2. So I'm 72.72 kilos times 30. So I would get 2.18 liters. I'd get 2,181 mLs, essentially 2 liters of fluid. The most I've given on someone is like 4.5. Sometimes you get patients who are like a couple hundred kilos because they're huge and they go into septic shock and you're having to hang like 4 or 5 liters of fluid at once. It's a lot. Fuios, it's a D. That's a D. That's definitely a D. And then after you get their blood pressure up, you treat the underlying cause of the shock. If it's a septic infection, you treat the infection. If it's anaphylaxis, you give them Benadryl and things, and Benadryl and steroids and things to calm down the inflammatory response, right? If it's a neurogenic shock, well, then you got to figure out what you can do about that, because spinal cord injuries are a whole nother ballgame. If it's obstructive shock, you go in and you clear the obstruction, whether it be releasing the fluid from around the heart and cardiac tamponade, re-establishing that lung by putting a chest tube in, or actually doing what we call a thrombolectomy, where they go in and actually remove that blood clot out of your lungs. Okay. If it's cardiogenic shock, well, if it's a heart attack, you take them to cath lab and try to save the heart muscle. If it's cardiomyopathy, you give them medications that can increase the contractility of the heart, treat the underlying arrhythmia, or treat the infection in myocarditis and arrhythmias. And then if it's hypovolemic shock, well, you just replace the volume and slow the volume loss. May you ask a question about shock and fluid? Sure. Dancy, thanks for the follow. Whatever you say, huh? Thanks for the follow. Welcome to Floppy Flock. Welcome in, guys. Saba Bunny, thanks for the follow. Fix Me Now, thanks for the follow. Sorry I missed you guys. What if a patient is a renal patient on dialysis? Do you still give them fluids and dialyze them while they're getting fluids? Well, so we see that all the time, especially like you think of like your heart failure patients too. You know, 90-year-old granny who went into urosepsis because she got a urinary tract infection and now she's in septic shock, and we give her 2.5 liters of fluid and she's already at like end stage heart failure where we've just overloaded her heart, right? It's one of those things where you got to treat what's going to kill you first. That's about it. Also, typically your dialysis patients are going to run really high blood pressures because they have no way of actually clearing fluid on their own because their kidneys are crap. So most of the time they're going to have higher blood pressures. But it's going to be up to the doctor to determine what the course of action is. They might go with less fluids than our standard protocol, but generally speaking, if they're in shock, you give fluids and then you deal with the repercussions of that later, because it's not going to matter if they die from shock. What happens during a heart attack? You get a blockage in the artery that supplies blood flow to the heart muscle that causes the heart muscle to die, which causes the heart become uncoordinated or unorganized, which then causes a lack of blood flow. Essentially, your heart muscle dies because a clot blocks the blood flow to it. ER will not let you leave if it's life-threatening, right? I mean, if the patient is alert and oriented and able to sign the paperwork and understands that them leaving puts them at high risk of death, we cannot legally keep you there. I have had patients who were very sick leave against medical advice because they did not want to stay in the hospital. And I tell them, as long as they are capable, and I tell the doctor, and the doctor talks to them, and we try to tell them, and some people just don't want to be in the hospital. They'd rather go home. I'd feel bad if a patient doesn't make it. Yeah, you get used to it. You don't get attached. AMAs. I had a guy once I had a patient, we were extremely busy. So I did this out in the waiting room because he wanted to go home. And the doctor came and talked to him and everything. He was in like end stage liver failure. So he was jaundiced. His skin was like Simpson yellow. You could see it. His eyes, his sclera was super jaundiced. Guy was like vibrating because of how he was like very vibrant with how jaundiced he was. And he wanted to go home. And I went out and talked with him. The doctor went out and talked with him. And I brought the paperwork out to him. I said, you understand that if you leave, you could die. He said, I understand that. And I said, I want you to tell me that. He's like, what? And I said, I want you to tell me the words. If I leave, I could die. And he kind of gave me this look. And I'm like, I'm not going to let you sign the paperwork until you do. And he looked at me in the eye and he said, if I leave, I could die. I said, okay. If you can bring yourself to say those words, I know that you understand. And he signed the paperwork and he left. And I don't remember his name, and it's possible he died. I don't know. Look like shit syndrome. He had a bad case of look like shit syndrome. You can't hold yourself responsible for someone else's ignorance. Exactly. I will be there to treat you regardless of whatever stupid reason you come in. I'm probably going to make fun of you for it though. But I cannot hold you responsible if you want to leave. It's some patients I will go out of my way to like really try to convince them to stay in the hospital. And I used to be pretty bad about trying to convince patients to stay in the hospital when I was a new grad. Because I was like, oh no, like you can't leave. What do you, no, you got to stay. We got to get you better. And sometimes I'll do that for patients who I really think need to stay. But most of the time they're like, I want to leave AMA. I'm like, okay, here's the paperwork. Sign away. It's your life, not mine. Here you go. Door is that way. Enjoy. We'll fill that room right back up. Don't you worry. I got plenty of people waiting for that room who'll be much more appreciative of the care I'm giving. If you're healthy enough to sign out AMA, then you're probably okay. You don't need to be in the emergency department anyways, except for the rare cases that some people do. Is it out of monetary concerns? Sometimes. Sometimes people just don't like waiting. They have other things they got to do in their life, and their headache that they wanted to get checked in and, come in and get checked out in 45 minutes and be out, had to wait 4 hours. So they end up leaving. Okay, let's recap in just a second, because this part of the song is really good. Wait for it. Hold! Wait for it, guys! Okay. So let's recap shock. Where are my notes? Here we go. Shock is defined as the life-threatening clinical state caused by caused by system-wide or body-wide deficiency of blood, specifically a massive system-wide drop in blood pressure, which leads to a decrease in perfusion, which leads to a decrease of resources for all of your organs, which eventually leads to organ failure and organ death, and eventually your own death. This causes oxygen deprivation, buildup of waste products, which eventually lead to the death of your organs. There are 4 main types of shock: hypovolemic shock, cardiogenic shock, obstructive shock, and distributive shock. Hypovolemic shock refers to a drop in volume that causes your body to have a drop in blood pressure, which leads to a decrease in perfusion. This is typically resulting from some kind of external trauma, which causes a massive hemorrhaging, or some kind of internal bleeding, like a ruptured aneurysm. All right. This can also be from excessive vomiting, excessive diarrhea, excessive urination, or things like a massive burn, which can cause a lot of fluid to leak out through the skin. That loss of fluid causes your blood pressure to drop. Cardiogenic shock are issues that arise with the heart's ability to actually pump and do its job. Things like heart attacks, which actually damage and kill the heart muscle. Things like cardiomyopathy, which causes the heart muscle to dilate and become weaker, which decreases the amount of output it can, decreases how strong it can beat. Certain things like heart arrhythmias and myocarditis can affect how the heart beats as well. As that heart's function becomes inhibited, your blood pressure drops, thus your perfusion drops. Obstructive shock comes from a blockage somewhere within one of the major circulatory systems in your body, something like a pulmonary embolism, which blocks blood flow to the heart or to the lungs, or something like cardiac tamponade, which actually blocks your heart's ability to function and blocks its ability to pump properly. Something like, deflated lung or collapsed lung, a pneumothorax, which is obstructing the lung's ability to inflate, which thus obstructs blood flow. So this is like a blockage somewhere in the pipes. And then you have distributive shock, which is the most complicated one out of all of them. Distributive shock is a massive excessive dilation of the blood vessels, usually related to one of 3 things: a septic infection, which is an infection that gets into the bloodstream, which causes a release of cytokines, which causes your blood vessels to dilate and become open and wide, and also causes fluid to leak out, as it generally would with an infection, which causes a decrease in blood pressure and a decrease of perfusion. Anaphylaxis, which is an allergic reaction to something that causes a massive release of histamine, which also causes your veins to dilate, which causes your blood pressure to drop, which causes a decrease in perfusion. And then you have neurogenic shock, which is damage to the spinal cord, specifically the areas responsible for vasoconstriction. When you lose that ability to constrict your veins become dilated, thus your blood pressure drops and your perfusion drops. The signs and symptoms of shock: number 1 is going to be low blood pressure. Number 2 is going to be high heart rate. Number 3 is going to be respiratory rate. These are usually the hallmark signs of someone who's in shock. All right. You might also have some lactic acidosis as your cells start to revert to anaerobic metabolism and breaking down glucose, which turns into lactic acid, which causes your blood pH to drop, which causes you to become more acidic. You can have things, certain signs of organ damage, such as altered mental status, decrease in urinary output, and decrease in cardiac output, as well as elevation in some of your blood work, such as your creatinine and your troponin. And then you can have this mottled, kind of bluish looking skin that can occur on the periphery, or you can have red flush skin, depending on the type of shock that you're going into. The treatment for shock includes fluids, lots and lots of fluids. The more, the better. You just jam them full of fluids, and then you treat the underlying cause of the shock. If it's due to a traumatic injury, you stop the bleeding. If it's due to an obstruction, you remove the obstruction. If it's due to cardiogenic, you fix the heart. If it's due to a septic infection, you treat the infection. If it's due to an allergen, you treat the allergen. And if it's due to a neurogenic issue, such as a spinal cord injury, I have no idea how to fix that one. What'd you guys think? Not bad, huh? Pretty good. It was not a bad lecture. I thought it was a good one. Did you learn something? What did you learn today? Tell me what you learned today. I hope you were taking notes. The lecture was shocking. Boo. 10 out of 10 needs more fluids. Speaking of fluids, I'm gonna take a sip of water. You do not want to get anaphylactic shock. I mean, we could treat that, although it will kill you. Is it a type of shock when your nerves go off quickly when you're falling asleep? No. That's what we call, that's a, what is that? Like a hypnic jerk, I think they call that. You're talking about when you're about to fall asleep and then you like suddenly startle. I believe it's called a hypnic jerk, an involuntary twitch of one or more muscles that occurs as a person is falling asleep. It tends to happen just as the person is transitioning from a wakeful sleep to a sleeping state. Hypnic jerks are a type of involuntary muscle movement called monoclonus. Hiccups are another common form of monoclonic or monoclonus. That's what I think you're referring to. Hypnic jerk. 11 out of 10 needs more fluids than collie pets. Ooh, I'll take pets. Can we cover electrical shocks next time? I can't make a whole lecture out of that. It can mess with your heart rhythm and you can leave really cool scars on your body. You learned something today. Well, I'm glad. You don't like having those? Apparently, Tux has told me a number of times that apparently I have those. Because I remember some of the first few times that we slept in the same bed together. He was like, what the hell were you doing last night? You were jerking all over the place. You were like twitching. And I was like, I don't know. I was sleeping. He's like, yeah, your foot kept like twitching. He got mad at me. Or he didn't get mad at me, but he was like, what the hell? What to do when a patient has been attacked by a Pikachu? Hopefully they're not dead. Had more than my fair share of electrical shocks when working on house wiring. You got to be careful with those because if you get a strong enough electrical shock, it can disrupt your heart rhythm. Guys, do you want to play more Quern? Quern? Cinder chases sleep. I chase sheep in my sleep. I try. You know, I'm always working. Always working. Quern? You want to play more Quern? More Quern? Quern! Don't you hate when you eat corn and then like a day later you see it in your poop and you're like, ew. Why did I eat that? And it's like you look at it and you're like, ugh. Why didn't you get digested, corn? What the hell? It doesn't take a whole lot of amps to kill you. It really doesn't. Too much information. Okay, like you've never had corn and like you've never seen it in your poop a day later. Okay, yeah. You just magically can digest corn unlike all the other ones, you know, all the rest of us. Okay. Corn is worth the regret. I've never heard anything so adequately put. Corn, it's worth the regret. Yes. Broster, hey, Broster, hey. Oh my God. That's a good way to put it. It's worth the regret. Although I can't say I've ever like eaten corn and then the next day been like, oh God, I should have done that. Oh, it's so terrible. Like I can't say that the amount of regret I get for eating corn and then seeing it in my poop is massive, but it's definitely worth it. Broster, you definitely came in at a good time. I've never seen corn in my poop, but have seen time release capsules. Yeah, eat more corn. How do you guys like your corn? I like it right off the cob with a little bit of butter. Delicious. Popcorn's pretty good too. Although I guess that is corn, right? Technically, corn kernels popped. Although you get that little one, you ever get like that little popcorn kernel that gets like spot welded to the back of your throat and you can't get it out for a day? You feel like you're choking on it the entire movie, trying not to cough because all your friends are near you and don't want to embarrass yourself. Cream corn is nasty. I like cream corn. Or like a corn casserole. Cornbread is the best way. Cornbread, it depends on the cornbread. It depends on the cornbread. It has to be moist. I don't want no dry cornbread. It's got to be nice and moist. As most breads and cakes should be moist. All right, let me load up Quern. Corn. My buddy had cornbread vape. Ew, disgusting. That's disgusting. Quern. So I think the last time we played, we were doing like alchemy. We were making things. Yeah, corn vape, that sounds disgusting. Vaping in general is pretty gross, but corn flavor, cornbread, ill. I definitely don't like cornbread enough to be like, you know what? I'm going to get a flavor of vape juice, and cornbread is my number one. Let's go. Like, I do not like cornbread that much. Will you cover the effects of radiation and or radiation in medicine? I have not done a radiation one yet. He bought it as a joke and it was good. Ew. I wouldn't even buy it as a joke. Makes me feel gross. Ugh. This game is, the loading on this game is, come on. Come on, you got it, Quern. Shugaka, can you change the game? Uh-oh. Uh-oh. Uh-oh! Ah! Well, that's not good. Okay, there we go. Ah, hey! It just had to spaz out for a bit. Okay, I need to put water in there somehow. So I think what were we doing last time? I was trying to make this. That's right, I had to make that. Because I need... Where was it? There was a recipe somewhere. There it is. I don't know what this recipe's for, but it's for something. Oh, it was to dissolve the white crystal so I can get that key. That's right. And then I had... I don't know what... This is what we were gonna do, I think. So I need 2 of that. Yeah, it's boiling. Listen to that bubble. Okay, so we got 2 of that. 1 orange, 2 red. 1 orange, 2 red. Groster with the 100 bits.
Bubble, bubble, toil and trouble. 1
purple, 2 blue. Dude, Brosty, come with the 100 bits. Bubble, bubble, toil and trouble. Okay, what did I say? 1 purple, 2 blue. Love your classes, Cinder. I hope to catch the next one. Good luck on turning lead into gold. Thanks, Kindle. I appreciate it. Okay, now I can put this here. Okay, so that'll help. That looks like it cures plants. Is that what that does? Were there plants over here that needed curing? was a goddamn waste. Are you freaking kidding me? Did I pour it all in there? Oh my god. What the hell? Hold on, actually, I need to do something while I'm here. Okay, left is blue. So blue. But I can't write more? Okay, there we go. Blue. White. Oh god! Wrong buttons. Orange. Is that yellow or is that orange? I'm gonna say that's orange. Red. Oh, do I have to pick these? Maybe I have to pick these. Is there a way to pick flowers? I don't think. Okay, hold on. Is there a way to collect water? Or maybe there are some plants that need to be harvested. I don't know. We still need to make this. And I don't know how to make that. Because I need it for this recipe. But all I have is this recipe, which lets me... This is to heal plants, it looks like. Let's go see what else we can find. We got some new items. Let's go mess around with a few other things now. Because we unlocked the rest of the map. So we can come back to this. And if we can find items that need to be healed... I think we've done everything over here. You don't have flowers to pick yet. Okay. I got that fire. I got this fire crystal. Maybe we can do something. I have an idea. I have an idea. You guys remember the telescope? Can we do something with the telescope and the fire crystal, I wonder? Is there something I can burn? First severe thunderstorm of the year. Oh, I'm so jealous. I love thunderstorms. I absolutely love thunderstorms. Can I burn that? Oh, I can't put it in there. Wait, what did that what did the one on the what did that show? Oh, that was for that. Okay. I don't really know what the purpose of that is yet. And so that's what I need to make. So that I have one of those already. So I got this one right here. So that's what I need to make that recipe to dissolve that crystal eventually. I don't quite know what that means yet. Still haven't really been able to figure out this. Does something. I think we've done everything we can do in here. Except we can't open that yet. I have an extra jug too. The button looks like a middle finger. We haven't been able to figure this out either. do you guys think? Any ideas? Was there anything back at the start? I don't think so. Ew, it sounded like someone go to the bathroom. Ew! Goes on that switch. You're talking about this one over here? I've tried stuff on this. You're talking about this one over here with the open handle? I've tried this. Something eventually goes in there, but we don't have it yet. And then we got the furnace in here. Can I bake anything? We did that. Did that. That's locked. We did the skull. I think we got everything over here. Yeah, I probably won't get it till later. That's the problem with this game, is a lot of things you're gonna have to do a lot of backtracking. And I feel like sometimes you get lost in the backtracking. I don't really know what this is. Oh, wait, I still have some. Are there plants that need to be saved? Easy bake oven? I definitely need the easy bake oven. It'd be amazing in VR. I bet it would. Okay, so I think what I have to do is I gotta pick plants and compress them into things. And I can use this to heal the plants. I gotta find plants that need healing. I haven't quite figured out where that is yet. No, Shugaka, it's okay. Shugaka, it's okay. I actually kind of want... Sometimes in games like this, it's okay for hints because it can get me going on the right foot, because I don't know where the hell I'm going right now. The pot bed can be the pot can be a test bed. I don't remember you used 2 blue in your... Oh, okay. You're saying if I take like this... That didn't work. Dude, Ellie Durr, coming with the tier 1 sub for 10 freaking months. Eli, Jesus Christ. Eli Durr, coming in with the tier 1 sub for 10 freaking months, dude. 10 months. Pretty much since the start. Thank you so much for the 10 months. Eli dear, you're covered under collie care. From the antlers to those hoovies, I got you covered. So I guess that wasn't the right way to do it then, huh? You missed class? You did. Oh, it's because I don't have anything in there. Oh my god. Why am I so stupid sometimes? Alright, let's try this again. I need 2 IHS, this guy here, purple. Mmm, delicious. Chat, remember this. 1 orange, 2 red, 1 purple, 2 blue. 1 orange, 2 red, 1 purple, 2 blue. Yes. Grimo! Dude, it's Grimo. He's all ground up. Look at him. There's orange and purple right next to each other. It's Grimo. I would be a great body pillow. It ain't gonna happen though. Okay, now there should be some blue in there. Son of a bitch! It didn't work! Cinder body pillow when? Never. I've talked about why I don't want to do merchandise. Oh! Watch this! I got it! Watch this, watch this. Okay, chat, you ready? Are you freaking ready? I need cinder body pillow. It's not gonna happen. It's not gonna happen. I am not doing merch. 1 orange, 2 red, 1 purple, 2 blue. Are you making your own IV fluids? Yes. I am mixing together medications with saline. Was it 2 blue? 2 blue. 1 purple. Counterfeit collie merch? Please don't counterfeit merch, please. Please don't do that. I'd rather you not. I'd really appreciate it if you didn't. Yes! Ah, we did it, chat. We regrew the plants. Now what? What's the next recipe? Oh, this is the next recipe. That's right. We need to make that one. Okay, so I need 1 of that. One test zen. 1 blue. Can I put more than 1 thing in there, or does it have to just be 1? All right, guys, let's remember this. Okay, so 1 blue, 1 Zaffa. Which one's the Zaffa? What? Which one's Zaffa? Oh, there's a page missing, isn't there? Unless we already have that. 2 of the stole, S-T-O-L, stole. I think that's that one. No, it's the red one. It's not that one, is it? It's this one. Okay, I can only do one at a time. Does this liquefy it? Oh, it puts it in there. I need 2 of those. That crunching noise is so good. It's so satisfying. Let's see. 1, 2, 3, 4, 5, 6. Okay. So I need the Arola. Okay, so that's that flower. Is that it? Or is that it? It's a red one. It's not that red one. It's not that red one. It's got to be this red one. And Lico? Which one's the Lico? That guy. This one. Oops. Alright, so now I need to figure out what this one is. Zaffa Newt. We might be able to just narrow it down. Are there any out there that don't look like any of these? Oh, I put the wrong... Oh my god, I put the wrong one in there. Oh my god. Okay, you know, we're just gonna scrap this. Trash. I need a blue one. Blue. Two of the reds. Did I check the cabinet in the greenhouse? Hold on, I'll have to go back. Alright, I need this one. And then that one. I think I have to make them regrow if I use all of them. You need 2 red. Did I only grab 1? Wait, what? Why is there so much? How did I screw this up? right? No, you screwed me up. Oh my God, I had it right. That crunch though. Give me smooch. COVID. No. Can we get some cinder soaps in the chat, please? Because COVID. Can you guys spam cinder soap? All right. Well, the only one that's not on the list, the only one that I don't have a picture of, is this one. So we're gonna go with this. Yes, it worked. Look at that. How many of those did we need? We just need one. Good. Okay. One Faru. Is the music too loud or you guys like it? Is it too loud? It's loud on my end. Music is nice. Okay. One of that. One green, two white, one yellow. One white, or one green, one yellow, two white. Yep, 1, 2, 1. Green, yellow. Is that white? Yeah. Boom. 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 Boom, 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 boom. All right, let's go dissolve a crystal. Blackjack, dude, get safe. Take cover. Relax. Don't. If you gotta go. If your power goes out or something, go to the basement. Get safe. Yeah, but use it on this big old guy in here. Yes!
Everybody do the flop. Everybody do the flop.
Whoa, holy freaking crap, Chirpy Cat. Oh my god.
Everybody do the flop.
Dude, Chirpy Cat coming with the 15 gifted tier 1 subs on this community. Holy freaking crap, Chirpy Cat. Thank you, thank you, thank you, thank you for that. Oh my god. 15. I'm not even gonna read them all because there's so many. Chirping Cat, thank you, thank you, thank you. You guys are all covered under Collie Cat. Thanks to Chirping Cat from Flops to the Beans. I got you covered. Well, goddamn. Well, goddamn. Can we get some Hyper Sheep? Chirping Cat, thank you. Your support has been amazing. I appreciate it. Thank you. I know where that's going. Wait, are you serious? I can't use it. Oh my god, I thought I could use it on this. Uh-oh. Okay, good. Melina, take care. Sleep well. I think I did everything in this room. Circle, hey! What's up, Circle? Any chance the weird adjustable key thing is going the thing by the big rock? This thing? The thing by the big rock. Oh, you're talking about that thing over there. Oh, this guy. Maybe. Ooh, look at you. Wait, which way was it facing? Top and right. I guess not. Oh god. I guess not. That makes sense. Oh wait, those little latches on the side, what does that mean? Maybe, okay, so it goes like this. Oh, okay. God damn it. Yes! Oh my god, so freaking smart. Pisco. Who was that? Pisco? Pisco? How do you say it? Pisco? Pisco? I feel like saying Pisco is makes me feel like I'm calling you, piss. Alright, there's a third one we need somewhere. So we got these bars. I don't really know what to do with these bars. What do you guys think we do with these bars with weird shapes on the end of them? We got a couple of them. Is there something with a plus shape in it that we need to do? Also, I haven't really figured out how to open up all these yet. I think we're good with the alchemy section for now. This is where we came in on the boat. This is where we get the plants and do that. Okay, so I think I'm done with alchemy for now. We can move on from alchemy. This was this area. We have the oven. We can keep that in mind. That we did. Scarface, take care. Thank you for the support. Okay, I think we're good down here. Lancelot, take care. I think we opened up this door and we got everything out of here. Yes. The pipes might fit into something. Yeah, I kind of figured that much. I think we're good with that. And then we got this whole system here, which we haven't touched. I don't even really know what I need to do here. I need to find things that weigh the same. There's got to be a reason that this is 3 scoops of sand. Daily Gamer, hey! You don't have to apologize. You guys don't have to apologize if you don't show up to the stream. You know that, right? Like, I'm not gonna take it personally. I'll be okay. I promise I'll be okay. I will survive. But hey, what's up? That's a fuse? What are you talking about? This is a fuse? I haven't quite figured out what we got to do with that yet. We got a couple new things, but we've kind of hit an impasse at the moment. Is there a way to open that door, I wonder? I feel bad not supporting my streamer. It's fine. Like, work, life gets in the way sometimes, and it's okay. You don't have to apologize. Shit happens. I know. I gotta find another one of these things. I need the last one. I need the next one of these. I'm salty about this. Let me in, damn it!
Everybody do the flop. Everybody do the flop. Everybody do the flop.
Dude, Wallenberg coming in with the 5 gifted tier 1 subs onto the community. Holy freaking crap, Wallenberg. Well, goddamn. Takashito Sudo. I think I said that right. Silvery Nard. Nard. That frigid bat and Jesse Sinclair. EQ2 girl. You guys are all coming under Collie Care thanks to Wallenberg. You guys are all coming under Collie Care from Flops to Beans. I got you covered. Wallenberg, thank you for the 5 gifted subs. Holy freaking crap. That scared you? Oh wait, what if I do like this? Okay, hold on. Watch this. Boom. Nope. Okay, so it's lit. I gotta cook something. Dragaroo, thanks for the follow. Welcome to Floppy Flock. Oh, that's right. I already did that. I need something to cut. Is there something I can cut this rope with? We have anything sharp I can cut the rope with? I think you missed a cabinet in the right of the plant room. Did I? Oh, the music changed. What, over here somewhere? Like in here? I can't open this. So I'm holding down Alt, and it shows me everything I can interact with. In the garden itself. Oh, did it open up? This? I don't know how to open these. Like, I don't know what these... I haven't figured out what these symbols mean yet. Yeah, I don't understand them either. I don't know what unlocks them. I have no idea. So if you're talking about that cabinet, it's closed. If you're talking about that cabinet, it's also closed. I'm not that far yet. Well, we're making progress. We're getting there. We're getting there. Yeah, give me some time, okay? The only thing I think, the only lead I have right now is this thing back here. Yeensy. I don't know what the hell this does. Also, there's a path there I would like to get to. I don't know what that does. There's a path right on the other side of this. Put the blue one, I tried that. See that right there? I don't know how to get to that. Starting to think that switch is not a bridge that extends. We would have to be on the other side. You think so? You think it does something over there? But I don't know how to get over there. Where's my map? Where am I? Where am I on the map? Where should... Okay, so I'm here. So I need to figure out here. So North Shore, I got to about there. There's something in this area I need to be able to access. What's over here? South Passage. Oh, that's a door. That's a locked door too. The gardens, the alchemy lab, the hanging platform. We've been there. It emits light. Yeah, I see that. And it turns something on. I'm lost. I don't know what to do. In the crystal lab, the cabinet had a glowing switch on the lock. Is that connected to the switch? You're talking about this right here? I tried that. I had that plugged in down there. I think it is still plugged in down there. It's not, but... Because I tried that. Talk about like doing like that and then running back up there. And trying this again. I don't know how to open these damn doors. See nothing. So we did this. I think we got everything we could get out of this area in here. Overworked artist, thanks for the follow. Welcome to Floppy Flock. What's up? Pretty sure we've done everything we can do up here. There was a stone up there that we haven't had access to yet. There's that up there. Oh, that was so cool the first time we did it. Cook the red crystal in the pottery oven? I don't think it's gonna work. I can't put anything on that, on the rack. I need something to hold it. Yep, that door's locked. Make pizza in the oven? I wish! But remember, there's no, you don't lose food here. Everything here is taken care of by whoever is running this place. There's gotta be a way to open that door. Boo, 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 boo. Do, 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 do. Where was the pizza oven? It's down here. Oven is down here. Where am I at on the map for here? This is the North Shore. Yeah, see, that's not gonna do anything. See, I can't even like hook anything to it. How's the stream gone? It's going well. If we can figure out how to... Oh! 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 I forgot about that. Okay, a key. Oh, finally I can open that stupid door.
After decades of hard work, experimenting, and prototyping, I achieved a great progress in crystal engineering, and it clearly became one of my many expertise. This was the time she first appeared to me. At that moment, I realized that I was never really alone.
Uh-oh. I want to be alone.
The
Don't talk to me.
sense of being watched I used to feel was probably her. She introduced
You love my animated
herself
stuff? Well,
as the
thank you. I
origin
appreciate
of
it.
This world. What a miserable lie it was. She had no right to claim such a title.
She had no right to claim such a title. What in the hell is this thing? I wonder if my crystal powers this. Because that is the crystal laboratory there. Okay. Well, we can start making some more progress now. Oh, I gotta do this animation every time. You don't want to be alone, you have us. Yeah, I know. Well, yeah, you guys can hang out. You know, sometimes it's nice to be alone. Okay, just saying. Sometimes. The only person I don't want to be alone from is Tux. I like having Tux around. Oh, for the love of Christ. Bucket.
She was convinced that if I stayed, I would soon reach a point upon which I would no longer be myself. I couldn't understand her point.
Excuse me.
Although she tried to convince me to leave the island, I did not listen.
I did not listen. I
I
not.
knew that the knowledge I gained could have changed my entire civilization for the better. The gateway was fully operational at the time, but I didn't know for sure whether I'd be able to find Quern again.
Quern,
It took me
Quern.
14 years to locate this world. I couldn't take the risk. I wasn't ready to leave all my work behind. Not yet.
Oh. Hey, we can go see other places now. I don't know what this does yet. Renuman, thanks for Renuman, thanks for the follow. Welcome, Floppy Flock. Welcome in. Okay, so we can go to all the rooms that have that projection on it. I don't know what rooms those are though.
Woohoo!
Any of these
Shot
open
spot.
up? Miss Pontiac, thanks for the host. We're gonna have to remember which one of these have what. Okay, let's do this. Watch this. Ready?
Woohoo!
Shazbot! Thanks for the host! Guys, can I get some Cinder G's in the chat for all these notes we're taking? We're taking a bunch of notes right now. You tell me that doesn't go in there? Okay. But no, I'm just gonna put that there. Oh, it opened up this one. This one's already open. Maybe it already opened up the ones that it's supposed to open. I don't know. I'm gonna take notes on them anyways. It was open to begin with? I think so. I don't think I actually did anything. I don't think I actually changed anything with that. Let's go back to the power room. Yeah, so I need more of these things. What is this? Looks like a butthole. My butthole! Okay, so I press them together in this thing. Oh, we did get a key. We did get a key. A key to what? A gear room? Were there any gears? What rooms needed to be unlocked? This one down here, maybe? No. Might be a fuse. It looks like I have to make it. Yeah, see? I need like... Looks like I need to make them somehow. But this offers up new and exciting things for us to do. What do I have right now? I have this key. I gotta figure out where this key goes. Let's go back up. Where did we just open up? That north, okay, so that would have been down on the north shore. Nope, not there. There. And then back up there. Let's see if I turn that thing on. Dude, Tangerine Boost coming with the Twitch Prime sub for 9 freaking months. Tangerine! Vitamin C incarnate. Tangerine, what's up? Tangerine, you're covered under collie care from the flops to the beans. From the vitamin C to that citrus flavor, I got you covered. Something, how, I don't understand what is this missing? Something in there needs to power this? Or does this power that? Well, my idea was wrong. Looks like technical drawings for the thing. Maybe that's what the oven is. But I haven't figured out how to get anything into the oven. You know what I mean? Like, I have this pot that you think with its 2 hooks would fit in there. And then this key, I got this key for something. Here, maybe? Dude, Tangerine Boost gifted out a tier 1 sub to O'Brien. Holy freaking crap, Tangerine. O'Brien, you're covered under collie care thanks to Tangerine from the flops and the beans. I got you covered. Well, gosh damn. Tangerine. Thank you. That was super nice of you. Thank you, thank you, thank you, thank you. The pot is wood. Doesn't want to go in the furnace. I don't know. Typically pot likes being burned. I feel like, can I put it on there? Maybe I have to put something in the pot and press it on here. I probably have to use that scale for something. Maybe to weigh them out. I would love to find out where this key goes too. And we're not done with this yet. Oh, what was back here? Didn't we open this up? That's where we got the red crystal, that's right. There wasn't anything else in here. Whaler, there's no songs because we're playing the game and the game plays its own music. And also song request is long dead. Rips, can we get some F's in the chat for song request, please? Can we get some F's in the chat for song request? How fun of a time it was when song request was actually a thing. Your ex burned water? That's impressive. Okay, I'm gonna keep that with me. Dresden Fall, thanks for the follow. Welcome to Fobby Flock. Welcome in. Oh, what the hell? Okay, okay. That's right, I forgot I can do that. Okay, watch this, watch this. Idea. Okay, so we take the fuse, we measure out the amount of sand, we press it in the bucket. Maybe. Watch this. Hold on. Okay. Yoink. We got an achievement for that. Find what is hidden. Oh, that's right. It did power the door. How am I supposed to know how much to do for it then? What was that symbol though? I don't know. Can we look for a green crystal? I know where it's at. It's up there somewhere. I don't remember what that symbol is. Try switching the fuse, sacrificing a door for another one? What do you mean? Switching the fuses also switches which logo is lit. The lit logo unlocks doors. I know, I get that. So it actually doesn't. You can put it in any one of these, and it's only gonna light up the first one. Put it there, it'll light up the first one. But this does something. Not really sure what though. There's another tube to the side. What are you talking about? It's the same symbol. Because remember, that was the symbol. Didn't we see that over? It was right here. Or maybe it wasn't right there. What if we, so we got, I think, so I weighed this out. So this has got enough in it for, where's, there it is. That symbol is on closed door. I know, I'm aware. Is there a way of like pressing this? See the symbol in the square? What are you talking about? We also got this key too. Don't forget, we got a key. We got to find something to do with it. I don't think there are any other gates that need to be opened at the moment. Was that? No. This way. Wasn't there a door with a lock? I didn't have a lock. Shit. I thought it did. Okay, so this is a way of measuring out sand, I guess. For a purpose that I'm unfamiliar with. We got that, because this goes in there and gets filled up with sand based on weight. Then what do we do with it? I still don't know what the hell that is for. Maybe the square symbol by the press thing has something to do with the combination lock? Square symbol by the press thing. What are you talking about? Square symbol by the press thing. In there? Talking about that? I don't think so. It says 641. How does that say 641? I don't understand. Okay, so this goes to 12. I'm looking. Can we get some juice up lookers? I'm looking in the chat, or I'm looking in the room with the blue crystal. It's mock cipher. That doesn't really help me out here though. 641. That's 6. That's 4. That's 1. We still got this key, by the way, guys. Don't know how to get down there. Know how to open that. Not sure what we're doing with that yet. I got a key for something I don't know how to open up. There's nothing over there. Are you freaking serious? Hey, another fuse. All right, what is that in your cipher thing? So we had 641. What is that? What number is that? I have no freaking clue. Does the fuse thing fit into the top of the ladder? Oh, we can find out. Let's see. Let's see what this does. Deadly Gamer, take care. Oh, it unlocks a bunch. Okay. Which ones did it unlock? Okay. Wine glass and upside down person. Okay, so it opened up that. And it opened up that, so we gotta go back to the garden. It's back to the garden. Record the ciphers down. I think that square panel we couldn't open right away. We'll be using that. Square panel we couldn't open right away. Which one? Oh my god, look at it. More plants to use too. Oh, yes! Delicious. The squeezed liquids of the native berries have quite intense effects on one's senses. Though drinking pure berry juices would be almost unbearable for the human body, the substance this device mixes with liquids makes their effects significantly weaker. Be cautious, though. Even though they are diluted, some of them can be quite intoxicating. Fucking yeah, let's go. We're high. What does the other ones do? Well, this slows me down. Well, this makes me super fast. No. All right, what's the other one do? What's the last one do? Or does it do it with all of these plants, I wonder? Ooh, double vision. Shukaka. Let's see, what is it? Can we do it with like this? No, we can't. Okay. Okay. How does this help us? Let's see, did we open up? What other doors did we open up? We had to have opened up other doors. Can we eat cake in class? Only if you share. Okay, so now we can get drugs, but how does that help us? Double vision would do it, the telescopy thing? I don't know. Did we open up any other doors? That's what I want to know. I don't think we did. Oh, we were gonna see if that fuse worked upstairs on the ledge. Drugs don't help you, Cinder. Well, only if they're used correctly. Can I put the drinking cup in the oven? Maybe. I thought about that too. No, I can't. I can't put anything in there. I wonder if those symbols on there mean anything. Why did I see faces in the rocks? It's just the way they're textured, I guess. Cultivate and sell them? Yes, we'll just live here forever and sell our drugs. I'm not really sure what's missing from here. Do I have to do drugs to fix this? Maybe. What happens if you switch the symbols around the circle and square? Okay. I don't think anything. No, nothing. But you said that doesn't mean anything? Try using drugs everywhere, but the thing is, which ones do which one should I use? I don't really know what they do. This way. They don't necessarily tell you the benefits of them. Like, I don't really know what this, like, this one just made my vision green. Like, I don't particularly know what that does. And I think that one speeds me up, that one slows me down. This one, oh, does that one slow me down? Ah, let's just do more drugs. Yeah, this one slowed me down. That one sped me up, and this one gave me double vision, I think. Does it reveal what's behind the red smears? Maybe. I'll try it again. Here, hold on. This gives me, like, screwed up double vision. What if I use that? Okay, idea for that. Hold on, let me see something real quick. No, it doesn't. No. Okay. Well. I don't really know what to do from here, guys. We got a couple things we can kind of try to work with, but I don't really know. Can you mix them? Oh no, let's go find out. I don't condone mixing drugs, but let's go find out. I have a feeling you can't. Got him, meow meow. Thanks for the follow. Welcome to the Floppy Flock. Let's do green plus fast. Yeah, you can't. No. Neat. Guys, what do you think we should do next? I'm not really sure. Still don't know what the hell that does. Maybe if you get high while he was talking about seeing that lady or by that green light if you're able to get up there. I can't. I gotta figure out how to get up there. I think that's like logically our next step is to figure out, because there's a door over there that needs to open. There's this thing that I haven't utilized yet. We got this scale in here to weigh out sand. Idea. Idea. I've got 2 fuses now. I can weigh one. They seem to change your vision. Yeah, I kind of figured that much. There's got to be a reason for that pulley system and for me to weigh this, or to have this bucket full of stuff. Who here is American? I would imagine most of us. Although I know a good number of people in this chat are international. Is there anything we did that required another... like a weight of some kind? Do you like baseball? I love baseball. It's the best sport. It's the nerdiest of the sports, which makes it the best. It's just statistics and amazingness. Also, how do I get this open? And what is this? Can you see through the red paint? That's what we tried that, I thought. Oh, let's go find out. Let's go do more drugs. Baseball is boring. I mean, I don't think baseball is boring. I think baseball is freaking awesome. Cricket's pretty cool too. Want a minor hint? Sure. Am I a good boy? I freaking hope so. Make a drink with the plant that's next to the door. Oh, this is a berry. Oh, so is that one. Oh, let me look at the red paint. I bet it will. It sure as hell will. Shugaka, I never would have figured that out. Thank you. Oh, this sucks. I don't like this one. Taste them all. Okay, so we've done them all now. Sweet. Well, this just got a whole lot more interesting then. There's a lot of places with red paint on it. We can go back to that power room though. $3719. $3719. Oh, I gotta hit the button. Okay, what number is that? People who are looking at that, I don't know. Shugaka, thank you. That probably would have taken me forever to figure that out. Any idea? I know what number that is in that weird thing that you guys were talking about. Okay. So it opened up the middle finger and the mountain with the door. All right, so middle finger's there. That's in the mountain. Okay. Oh wait, that isn't quite the middle finger. That's a gem. Oh, I know where that's at. Okay. It's in here. According to my horrible math, you're a good boy with a touch of stimky and cute. I'll take it. That's not bad. What's this? Ooh. What? Okay. We gotta go find the other one of these. I think it's down here. Oh, Jesus. Tox! Just scared the ever-living hell out of me. Oh my god, I thought I heard someone come home. But what'd you get me? Yeah? You just shaking your head yes? Ooh, that's good. Thank you, babe. You brought my car. Wait, don't take my water away. What's that?
It's raining.
Is it raining like hard? Is it really? I like the rain. Yeah, let's do this. I took him out at like 1:30, so he should be good. Mwah. Bye, babe. Tux brought me coffee. Apparently it's raining out. Oh, it is open. Hell yes. The cave. Okay, we know this one. All right. Someone put in the chat. So hold on, let's see. Oh crap. All right, someone in the chat. Up, down. So put U D D D U D U U D D. Thank you. Locust Pocus, thanks for the follow. Welcome to Fobby Flock. Welcome in.
By now, it must be obvious to you that I connected these marked doors and entrances to the main energy converter unit. Actually, this feature has nothing to do with the crystal battery machine's main purpose at all. I've implemented this secondary function in order to direct you along the path and prevent you from spoiling the
Wow,
well-structured
you're just
course.
teasing me.
When the converter is fully powered, meaning that all the batteries are in place, it supplies energy to the mechanics. I can only hope that she will not interfere with our work. She's but a desperate echo of a fallen civilization lingering here agelessly. It is clear that she is not worthy of the gift that has been given to her.
I don't know who she is, but she sounds like a wonderful person. Hey, look, a gear. I'm sure we'll need that at some point. Definitely gonna need that. Definitely gonna need that. Okay. What? One, there's two ones. One. Shit, what was that number? The horizontal line is one, that's right. Which one? What was that original? What was that number? It was like 3917. I don't want to run all the way back there. No, it wasn't that. Son of Neotron, thanks for the follow. 3971, 3917. One of those through. 3719, 3971, 3719, 3719. Okay. Okay. Three there. 3. Wait. Yeah, 3. 7 is going to be a slash with 2, so the one right above it. 1. Oh. 1 9. Right? Oh no, there it is. Oh god, there's more numbers! What? Do I just have to do it in order then? One, 2, 3. 4, 5. 6, 7, 8. What the hell? It's an 8-digit code. Diagram 1, this one? 1, 2, 3, 1, 2, 3. Okay, that's 8. Yeah, you go. Here we go. No, didn't work. I think it mixed up 1 with 5. Oh, what else is here? Anything else here? No. Giangio, thanks for the follow. Welcome to Floppy Flock. Welcome in. Do I have to do the order? So those, maybe those in order? That doesn't make sense. Long lines equal 5, by the way. What do you mean long lines? That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then 11, 12, 13, 14, 15. I don't know, guys. What else did we get from here? We got this thing. Which I don't know what the hell that is either. Is there more red paint we can go take drugs for? I feel like there was more red paint smeared somewhere else, right? Wasn't there? There was another one in that plant room, I thought. Oh no, there was one in the plant room. Was there any red paint in here that I can do drugs for? No? Y'all got any more of that red paint?
Woohoo! Shot spot!
Wait, what are try the highlighted buttons from one chart in the order of the other chart. Wait, what? Also, that up there, by the way, matches something over here. It matches that logo there, so that's interesting. Okay, so you said that do this in ascending order, essentially? Okay. 3, 4, 5, 6, 7. No. 3. Okay. 3. 4, 5, 6, 7. That one is 15. Which one's 15? These 3. 1, 2, 3. That one, that one, that one, that one. Okay. Short lines equal 1. I know. So this is 2. Right? Where's 1? There isn't a 1. Because that's 15, right? Or 5? I don't freaking know. Bottom right is what? This? That's 3. I'm so confused. That's not 1, correct? Or is that 1? Is this 1? Right here? That is 1. And that's one of the ones that's highlighted. So 1, 3. 1, 3. Boom, boom. Boom, 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 boom. 1, 3. 4. 6, 7. I have no freaking clue. Press the 1 for starters and see if it resets. Well, I can press whatever ones I want and only reset when I've hit enough of them. All right, 1. That one's gone. 3. 4. 5, correct? But I don't need that because that one's not highlighted. So I can't use that one. That one is. So then I would go 4 to 6, which is down there. 6. 7. Okay, we've used both of those. We've used that one. We've used that one. We've used that one. So we got 3 left. 9. Boom, boom. No. That wasn't 9. I don't freaking know. This is hard. You mixed the last 3. Are you kidding me? Okay, what is this? Is that 17? Or is that 12? Or is that I don't know what that is. I guess 12. I don't know where I got 17 from. That's 12. That's 15, right? This right here is 15. And that's 19. So 12, 15, 19. Yeah, it didn't work. Didn't work. Or is that 14? Maybe it goes boom, boom, boom. Boom, 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 boom. Oh my god, get absolutely just screw this puzzle. Got an idea. We're gonna do drugs. We have drugs for this. I wonder if I do these and I snap a picture of it, if it'll stay while it's upside down. Let's find out. Hold on, before I go all the way back there and figure out this doesn't work. No, it stays right side up. You gotta be absolutely oh my god! All right, well, we know the order, so let's just do it again. Where was that? Where was I for that? Down this way. The telescope? I think I gotta do something with that, with the telescope. I don't know, I'll figure it out. Once I get done with this puzzle here, I'm probably gonna end the stream once we get done with this guy in here. Before I put that before I put that in the generator, I'll probably end it there, because I'm hungry. And this is destroying my brain. All right, so it was 1, 3, 4, 6, 7. All right, I'm gonna cheat. I'm gonna take a picture on my phone and then I'm gonna flip it on my phone. Watch this. All right, here's what I'm gonna do. I'm gonna take a picture of this on my phone. All right, I'm gonna go into my image editor. I'm gonna flip it upside down. Okay. Did the shading also flip? What do you mean? Oh, do you think this also changes, or do you think it stays like this then? And we just deal with the new numbers? Well, let me do something on my phone so it doesn't lock. Okay. Excuse me. Do you think now we use the same combination then, and we just do it with the new numbers? Oh Jesus. Well, no, because it's no, it does change them up. Did the arrow on the buttons flip? What do you mean? Yeah, this is flipped upside down now. So I don't know if I do the same exact puzzle with the new flipped numbers. I think I do. So with it flipped, we get that one. That one and that one. So one, is that 10? What is that? 2? 1, 2. No, wait, hold on. I gotta look it on mine. Yeah, 1, 2, and that one again. Holy shit, dude, this sucks. All right, this one I know that's 1. That's 2. That one and that one's done. I'm looking on my screen here, on my phone. That's 3, 4. 1, 2, 3, 4. I have 12, 14. 1, 2, 3, 4. That's 15. That's 12. That's 14. That's 19. 1, 2, 3, 4. 12, 14, 15, 19. Oh my god, screw this. What the hell? There's no 19. Oh crap. What is what's that one? That's 14. And what's that one? What's this one right here? That's 14? Oh, that's 16. Oops. Okay, 1, 2, 3, 4. 12, 15. I screwed it up. 1, 2, 3, 4, 12, 14, 15, 19. What the hell? Okay, so that's 16. This right here is 16. That's 14, correct? 14, 16, that's 12. Or is that 7? That's 7. Raymond!
Hi Cinder. How is the best doggo nurse I
1,
know?
2, 3.
Such a good boy.
Draven, I'm doing well once I can figure out this puzzle. Yeah, so that's 7. Seven, 14, 15, 16. Oh my god. I can't even with this puzzle right now. Do we try the same numbers again from the first time around? Let's try that. Let's see. It was, what were the numbers from the first time around? 1, 1, 3, 1, 3, 4, 1, 3, 4, 1, 3, 4, 1, 3, 4, 6, 7, 12, 14, 15. Okay, somebody write that down. 1, 1, 3, 4, 7, or 6, 7, 12, 14, 15. 1, 3, 4, 6, 7, 12, 12, 14, 15. Oh my god, what the fuck? All right, let's go figure out what this is. The telescope. Somebody had mentioned the telescope. Let's go look at the telescope. So I think the telescope's gonna give us the next one. Maybe we put this in the telescope? Oh, yes. Okay, and then we can do the... Okay.
Woohoo! Shot spot!
Oh, for the love of Christ. Okay. All right, guys, what I'm going to do is I'm going to read. I'm going to look at these. I'm going to read out the numbers to you that are highlighted, okay? Because I still have this pulled up on my phone. Okay, I'm going to read the numbers that are highlighted to you guys. You guys put them in order for me, okay? 2, 9, 4. Wait, there seems to be... Why is it... Okay, I see, okay. 294. Sorry. 284. 284. 9, 12. 10, 16, 14. Did you guys get that? 284. Okay, put them in order now. 2489. 2489 10 12. Oh. Canadian Dragon. Hey, what's up, CD? All right, hold on. Let me do this again. I'm gonna take out my phone. We're gonna cheat again. We're not really cheating. I think it's ingenuity. We're gonna flip that picture so I have that available. We're gonna do this again. Oh wait. I'm so stupid, chat. We're gonna try that again. I read it from the right side up. We need to read it from upside down. Disregard those numbers, chat. Disregard those numbers. I screwed up. I screwed up. Let's try that again. I had it right side up for some stupid reason. Okay, okay. Are you guys ready? 12, 10, 3, 7, 11, 2, 8, 7. Okay, now put them in order. Two, 3, 7, 8, 10, 11, 12. Okay. I said 7 twice? No, I did. What? Okay. Shit. All right, we'll do it again. Hold on. Let's try this again. Oh my God. It was the last one I said. The last one I said, I think is 6. The last one is 6. It's not 7, it's 6. Hold on. I got it. God damn it. Where's my drugs? I need the one that makes me run faster. Give me my run faster drugs. Yes, last one was 6, not 7. So disregard that last 7, make it 6. So it should be 2, 3, 6, 7, 8, 10, 11, 12. 2, 3, 6, 7, 8, 10, 11, 12. Okay. I'll head back this way. If this doesn't work, I'm done. I'm done. Okay. 2, 3, 6, 7, 8, 10, 11? Where's 11? 11, 12. Where's 12? Oh my God, are you... Try it again. Maybe I screwed it up. 2, 3, 6, 7, 8, 10, 11, 12. We're beating this puzzle. I'm not leaving this stream until we beat this puzzle. Is my image flipped? So I have it, I flipped it to the way that it's lined up now. Unless they're devious enough to say transcode that on the right side up one and then flip it. Is that what they really want me to do? I feel like that's not what they want me to do. Oh. There's no arrow. I know there isn't. All right, let me flip it upside down again. And I'm going to give you the upside down numbers now. I'm going to give you the upside down. So this is the right side up numbers now. So this is the normal numbers. Okay, you guys ready? 2, 8, 4, 14, 9, 12, 10, 16. All right, that's what they are if they're right side up. And then we flip it again, and now we try it like that. 2, 4, 8, 14, 9. Put them in order. Put them in order. 2, 4, 8, 9, 10, 12, 14, 16. Okay, let's try that. Remember, they're flipped now. This puzzle can suck my dick. Screw this puzzle. 2, 4, 2, 4, 8. Where's 8? 8. 9. Where's 9? 9, 9, 9. 9. 10. 12, 14, 16. 12. 14. Oh my god, get absolutely fucking wrecked. That puzzle sucked. That puzzle sucked. I did not like that. That was a chore. That was not... I know what to do here.
Woohoo! Shot spot!
Oh, actually, I think I already weighed this out properly. Okay, now I know why I need to weigh that. I believe it was 4 scoops. Where was that scale? All batteries weigh the same? I think so. Where the hell is the scale? Oh, it was up here. Oh god, does the bucket have weight? No. Metalworking saying no. Oh, for the love of Christ. The door closed on me. I gotta put the battery back. Oh my god, the bucket. I have to account for the weight of the bucket too, maybe? Oh my god. I just want the battery so I can go eat. I'm so hungry. Ah! The bucket's got a weight of 1. I'm doing 3 scoops and calling it a day. Get absolutely fucked.
Who
Whoa.
are you that wanders this
Who are
world
you?
uninvited? Another explorer?
Yeah,
What
can
are
you get out of here?
seeking?
Not you.
Power?
Drugs.
Immortality?
Get away.
Or are you just a fool looking for salvation?
I guess I'm
You
a fool.
can't simply enjoy the power of Quern, not without consequences.
Okay.
You must leave the same way you came here,
I would love to.
for your own sake.
Okay. Bye. That's where we're gonna end. Ugh. All right, well, we made some progress, I guess. I'll pick up with this tomorrow. I'll think about something to do tomorrow. I don't know. Cinder 7 done with this game. Okay, that we figured it out. Biscuits for the collie.
Biscuits for the collie.
Biscuits for the collie. Thanks, Trippy Cat. I appreciate it. Thanks 100 bits. Guys, let's figure out who we're gonna raid. I haven't raided Tristan in a while. Oh, he raided out. Tristan just ended. Well, that saves that. You guys want to raid Labrador or North Dog? North was in here earlier. Oh, we've raided North recently. Let's do let's do Labrador. That's gonna be our raid message. Screw these puzzles. Screw them. Guys, let's go raid Labrador. Ugh. Guys, today was fun. I hope you learned about shock. And I hope you enjoyed watching me get frustrated at that stupid... Those puzzles are ridiculous, dude. Those puzzles are ridiculous. Ugh. Guys, I'll be back tomorrow. I'll have something planned for tomorrow. I'm not sure what, but I'll have something planned. Until then, let's go hit up the discharge desk. Make sure you have your insurance cards ready. Co-payments due at time of treatment. All that other stupid stuff I used to say. Guys, let's go show the laboratory for some love, okay? I will see you guys tomorrow. Until then, have a good night. Bye.